Hey friends, John Bush here. It's been a while since I did a live video. Got a lot of stuff going on in my life, doing a lot of hustling actually, growing my business. But I felt like now was a good time to share some of my thoughts on this whole coronavirus stuff. Of course, that's been the focus of a lot of people's attention. And my view of this whole ordeal has evolved throughout this process. But now that we have more information about the virus, about its spread, about the mortality rate, and now that we've seen the negative effects of these lockdowns and shelter-ins, I wanted to share some of my insights and analysis in regards to the antibody tests that are taking place now, which are giving us for the first time the clearest picture of how many people actually have the coronavirus. And I'm frustrated about how this has all panned out. I am an optimist, I'm an idealist, and I genuinely believe that the future, long-term future, holds a lot of hope for freedom and human flourishing, although it's going to get really ugly in the short term. And we do have an opportunity. I'm going to do a video later on about this, maybe the next day or two. We do have an opportunity as freedom lovers, free thinkers, those that want to create a better world. We do have an opportunity now because a lot of people are really frustrated, really upset with how things are going right now, and they're going to be looking for different answers. And we have solutions that are decentralized, peer-to-peer, that aren't hierarchical, that are more resilient and anti-fragile. So I don't want to get into that now because I'll digress, but let's just break it down. First, I want to mention one of our sponsors, bravehealthstore.com. Follow the link if you're watching us in the Conscious Resistance. So Derek Bros in the Conscious Resistance can get credit. We do have KN95 masks. And so as we're going to cover, the virus isn't as deadly as originally thought, but boy, is it highly contagious, which is still problematic. So if you want to avoid catching the virus, if you are ordered or required by law to have a mask, to wear a mask, we have some really effective ones, KN95. They're the most effective next to the N95. So check these out, especially if you have older folks or people with pre-existing conditions in your life, or if you yourself have a pre-existing condition and you still absolutely need to go out. The KN95 mask is the most effective, one of the most effective ways to do that. Definitely more effective than cloth masks and all that stuff and bandanas, which studies indicate actually may cause more harm than good. So check out the link to Brave Health Store. We have masks available there. All right, let's get into it. So here we have here's the news, right? Here's what's happening nowadays. Here's what's taking place. There's antibodies tests, which aren't the same as the COVID-19 test. Rather, these tests test to test for immunities in your body. So you either got exposed to coronavirus, you had coronavirus, had symptoms, or you're asymptomatic, but now you've had the antibodies, and in the future you shouldn't have problems with the coronavirus. And the way that this whole herd immunity thing works is the more people that develop these antibodies, the more people that become immune, the less power, the less strength the virus has to cause harm, right? And I'm not out here saying that the virus is fake or it's a hoax. I genuinely believe that there is a virus and it is harming a lot of people, and there are indeed people dying. But as we learn from these antibodies tests, the virus has a much lower mortality rate than originally expected. And the conclusion that I would draw from that is that the policy of lockdowns and shelter-ins was not the most effective public health policy. As I've contended before, a policy more in line with Sweden's, whereby those that are sheltered in, those that are protected through social organizations. I'm a free market anarchist, so I'm not a big social safety net guy, but if we have this institution, it would be better to protect, to support financially, to help those that are susceptible to the virus, which are those that are older with pre-existing conditions, multiple pre-existing conditions especially. And now, yes, a lot of people do have pre-existing conditions, heart problems, obesity is a big one. But those people are sheltered in anyway. So let's just take a look at some of the numbers before I get on too much of a tangent. And I want to thank everyone for tuning in and invite you to subscribe to our email list so we can stay in contact with you. So in New York, this is a big one. This is a new one that's fresh. And then we're going to go over a few others that have come out recently. In New York, state of New York, an antibody studies find that 13.9% of residents have the coronavirus. Now, this is Governor Cuomo that's touting this as well. An estimated 13.9% of New Yorkers have likely had coronavirus, COVID-19, according to preliminary results of coronavirus antibody testing released by Governor Andrew Cuomo. The state randomly tested 3,000 people at grocery stores and shopping locations across 19 counties and 40 locations to see if they had antibodies. That's a pretty thorough test, unlike some of the other ones we're going to cover that weren't as thorough. With more than 19.4 million people, residents, the preliminary result indicate that at least 2.7 million New Yorkers have been infected with COVID-19. Now we're going to do something here live for you, and I'm going to show you how you determine the mortality rate. It's a simple equation. You take the number of people that died, divide the number of people that died by the number of people that have the virus. Then you multiply that by 100 and you get a percentage, right? Now, there is some debate as to whether the coronavirus deaths are being underreported or they're being overreported. I happen to be in the camp that says the coronavirus cases are being overreported, primarily because the CDC is given instructions now to report it as a coronavirus death if someone dies with coronavirus in their system. And there's also comorbidities where like someone had a heart disease or they had cancer, so on and so forth. Someone's asking if I'm a doctor. I'm going to take some comments here in a little bit. No, I'm not a doctor. I'm not claiming to be a doctor, but I am a logical person, and we're going to go over some common sense logic stuff here. And no medical advice here either. So I think that the deaths are more than likely being overreported. There's also some financial incentives when it comes to Medicare, which isn't all the cases, but the hospitals are getting more money when it's reported as COVID-19. But either way, we don't have any other numbers to go off of, so let's just assume that the number of reported deaths, and again, it's more likely that someone's going to get tested if they die and they have, and it's actually not all the people are getting tested that die of suspected coronavirus. If it's reasonable in the eyes of the doctor that the person has coronavirus, then it's being reported as coronavirus. So we're just going to go with that number, and we're going to do a test here. So we are going to go back to our website here, and we're going to go to this Reuters graphic here, and we are going to check out the number of deaths in New York. I also want to say, like, nobody should take any of this lightly. This is all really hardcore stuff, and people are dying and people are losing loved ones. So this is really unfortunate. But as Americans and participants in this society, we have every right to draw conclusions about things and give our opinion on how things should change. So I'm going to go to this map here. You can find it on drudgereport.com. And this is a map that's been really alarming, but it turns out there's even more cases than is in this number than are reported on here. But let's see if we can get the number for New York here. My computer's acting a little slow because I'm live streaming and everything. And again, the idea is there are far more people that have coronavirus than originally anticipated, than reported. As a result of that, the mortality rate, the deadliness of the virus is far lower than anticipated. And while this loads up, what that means is we still ought to be concerned, and people ought to change their daily habits, right? I'm not saying everyone go shout in the streets and spit all over each other. Not at all, because the virus is extremely contagious, right? So that's, even though it may actually have a mortality rate that's closer to the flu, it's way contagious. And I'm not a fan of vaccines, but a lot of people are taking the flu vaccine, which could help, although it's less effective than ever before. Okay, let me see. This is actually jamming up my broadcast here to try to figure out how many cases, because my computer's running slow. And the irony is, I'm not a fan of Bill Gates and everything that he does, and how they want to how he wants to surveil everyone. But I will say that I enjoy my Microsoft computer. Okay, here we go. We're clicking on New York. Now here's the number of deaths. All right, I'm going to grab my calculator. We're going to go back to the story with Andrew Cuomo. And again, remember, this is straight from the horse's mouth. It's estimated that 2.7 million New Yorkers have been infected with COVID-19. So we're going to go to this number here, a known number, 19,551 deaths. So we're going to take 19,551. You can see that. And we're going to divide that into 2.7 million. Okay, and the number we come up with is 0.00724. So we multiply that by 100. We come out with a mortality rate of 0.724. So that's less than 1%. Now, originally it was estimated by some that the coronavirus was going to be 10 times more deadly than the flu. It's estimated every year that the flu has a mortality rate of around 0.12 to 0.123. So according to this, that's like 5 or 6 times more deadly than the flu. Now, I will say about the numbers in New York, a majority of those numbers were going to be in New York City. And so it only stands to reason that when you have a densely populated area like New York City, there are going to be more deaths. There's also some stuff out there showing that whenever there's more pollution, people are more susceptible to the harmful effects. But this is just New York. Now let's check out Santa Clara County. This is a study that came out recently. There was also an article in the New York Times recently that covered the Santa Clara County and the LA County. But let's look at the actual Santa Clara County study here. So this study, background addressing COVID-19 is pressing health and social concern. And people are scrutinizing the study, but we're just going to go with the numbers that we have, and we're going to take a look at it, okay? To date, many epidemic projections and policies addressing COVID-19 have been designed without seroprevalence. That's when they do the antibodies tests. Let's just get down to the numbers here. In a sample of 3,330 people, adjusting for zip code, sex, race, and ethnicity. Now, this study's been criticized for the way that they got the participants through Facebook ads. So the numbers that they range, they say the prevalence of these prevalence estimates, that they say that Santa Clara County ranged from 2.49% of the population in Santa Clara County to 4.16% of the population. So they extrapolate that with the county, and they estimate that 48,000 to 81,000 of the people in Santa Clara County are infected. So now, I think someone was just poking at me for saying the flu vaccine is effective. I don't subscribe to flu vaccines. My kids aren't vaccinated, but the point is, there aren't any vaccines, whether they're effective or not, for coronavirus. There are vaccines for the flu. So even if they're 10, 20, 30% effective, then that would make it easier to avoid harm from the flu. We're not going to get into that vaccine debate. Okay, so we're looking at Santa Clara County now. So let's go back here to this Reuters thing. We're going to pop in Santa Clara County right here, and we're going to go ahead and do the mortality rate again for the number of deaths in Santa Clara County. So in Santa Clara County, we have 94 deaths. So we're going to take 94. We're going to divide it by the number from the study. This is just a projection. We're actually going to go with the low number, 48,000 on the low end. 48,000. Then we're going to times that by 100, and we come up with a mortality rate of 0.195, just above the flu. Now, let's say that we'll go in the middle of 48 and 81, which would be around 65. No, 65. 65. Yeah, so we'll say around 65,000. So we'll take the 94 deaths and divide that by 65,000, which is approximately in the middle of the range that they provided in this study. And we're going to multiply that by 100, and that comes out to 0.144, which is right around the mortality rate of the flu. There's another study in LA County, which is a giant county. They estimate that between 221,000 and 442,000 people have coronavirus antibodies in their system. Just real quick, just to show you the numbers here, we'll go check out LA County. Where is LA County here? Los Angeles County, 732 deaths. 732 divided by 221. We'll go right in the middle at 300,000 people that have it, equals times 100. Okay, we have a mortality rate of 0.244. Okay. There's also studies of a homeless shelter where 36% of the people in the homeless shelter had it and had little to no symptoms. They were asymptomatic. So I want to point out a couple things about this. One, the sensationalist media has blown this crisis way out of proportion, caused lots of panic, harm, especially to people's livelihoods. And it's funny when you see these antibody tests. Myself, I consider myself a critical thinker. I think, wow, so many people have COVID-19. That means that the mortality rate is far lower. And that's the conclusion I draw from those numbers. Well, when you look at the headlines, they have more sensationalist headlines. I think I took it down, but there's all sorts of headlines that are like, far more people have coronavirus. Coronavirus has spread more people than ever imagined. This is way out of control. That's the tone that the media takes. But it's not the tone that the media took when they were caught with a hot mic here. I'm going to play this video for you here. And you guys tell me if you can hear this, okay? This is a White House briefing that hasn't started yet. And there's some banter, which they later said they were joking. Maybe they were joking about some of it, but they draw the right conclusion, the same conclusion that I draw. So check this out. Let me know if you guys can hear this. See, he said the case fatality rate is 0.1 to 0.13 according to USC, which is in line with the flu. They're joking. You could take off the mask, he says. All right, y'all are reporting there's no audio. Sorry. So they're like, whoa, so that means the case fatality rate's right in line with the flu, right? And then they later say, wow, so it was all a hoax. Now, maybe they were joking. Maybe they were doing banter, and who knows? But the analysis is correct. A new study out of Santa Clara County, or maybe it's LA County, shows that the mortality rate is actually 0.12 or 0.13. Oh, so more like the flu, right? So there's a lot of implications for this. First of all, the public health policy and approach to this by governments all across the world, except for Sweden and a handful of others, was this lockdown, shelter-in-place phenomenon, which at the end of the day, like old Trump said, he didn't want the cure to cause more harm than the virus itself. Trump, love him or hate him, that's a good soundbite. And now what we see, a lot of people, especially left-leaning, progressive, socialists that don't genuinely understand economics, when people are like, we need to open up the economy again, they say, oh, you care more about the economy than people's lives? People's lives and the economy are inextricably tied together. When we speak of the economy, we're not talking about the stock market or businesses making profits. We're talking about who gets what, when, where, and how was one definition of the economy I learned in college. We're talking about the allocation of resources, both on a national scale, a meta scale, but on a micro scale within a household as well. When we talk about the economy, we're talking about how your family budgets for the future. We're talking about mortgage payments, rent payments, grocery bills, electricity, saving money for your kid's college, putting your kid through private school, clothing for your kid. We're talking about healthcare. It's all inextricably tied together. And now everyone's like, oh, we got to shelter in. And there's, if you notice, there's always such division in this country and all around the globe. But it's mainly, this is a generalization, but there's a tendency for conservatives, more Republican leaning, and obviously libertarian types to want to open the country up. And for progressive, Democrat, left-leaning types to want to shelter in and control. There's a lot that goes into this. I think in general, Democrats are more comfortable with controlling other people's lives, more left-leaning types. They trust authority and science more, right? Like the whole stuff going on with climate change. Trust the scientists, and then the media, especially like CNN and Anderson Cooper and them. They're always just touting, well, the scientists say, the authorities say, and it's like, oh, well, we better accept that as truth. When in reality, the World Health Organization has gotten so many things wrong on this front. But here we have a story coming out of the United Nations, right? You guys are going to shoot me down for using them as a source, but I think it's worth pointing out. Where the heck is this story? I lost it here. Let's just pull it up. I think it's worth pointing out, United Nations famine, that now the UN is expressing concerns that there could be a famine of biblical proportions. Coming to the world. At those people that are like, oh, you want to open up the economy at the expense of people's lives. It's like, no, it's all inextricably tied. The coronavirus plague could spur multiple famines of biblical proportions across the world if urgent action isn't taken now. These are all Illuminati, New World Order types, of course. Forgive me for speaking bluntly, but I'd like to lay out for you very clearly what the world is facing at this very moment. At the same time, while dealing with COVID-19 pandemic, we're also on the brink of a hunger pandemic. Millions of civilians living in conflict-scarred nations are being pushed to the brink of starvation amid the crisis, with famine, very real and dangerous possibility. And this isn't necessarily because of the virus. Rather, this is because of government's response to the virus, this shelter in, this lockdown. Early on, I hesitated to take a position because, as someone said, like, you're not a doctor. No, I'm not a doctor. I'm not a public health official. I take a position. I like to think that I have some influence. And when it comes to what we can do as a result of this, creating decentralized social organizations, growing your own food, permaculture, all that, I'd like to make a difference. But when it comes to massive public health policies, what I say doesn't change the public health policies of the country. But I took a position that it would have been far more effective we could maintain the economic growth in this country, economic activity. It would have been far more effective to shelter in those susceptible populations. Early on, we already had data about who it is that dies from this virus. It's people with pre-existing conditions, with multiple pre-existing conditions especially, and the elderly folk. And no, I don't want those people to die. No, I'm not completely insensitive to people that die from coronavirus or people that could die from coronavirus. But the point is, everyone's sheltered in anyway. We might as well let people that are healthy, people that want to take that risk, right? A society with personal responsibility, we might as well let those people continue on about their lives, being productive, maintaining an economy that isn't in total crisis, total collapse. And then those people, through their tax dollars and through the government programs, no, I don't advocate for social safety programs. I advocate for decentralized peer-to-peer mutual aid. But because those institutions exist, it would be far easier and more effective and less costly and wouldn't crash the entire economy or threaten hyperinflation to protect, look after those people that are sheltered in. And this is the policy we see Sweden doing. And yes, there are people dying in Sweden, but their entire economy hasn't collapsed, and they're probably going to come out far ahead in the future. So that's it in a nutshell. The coronavirus stuff, it's not a hoax. It's not totally fake. It's a virus. And again, the concern is, yes, the mortality rate is far less than originally anticipated. But the coronavirus, COVID-19, is highly infectious. And for that, like, there's a number, it's like in number that talks about the infectiousness of the virus, and coronavirus is highly infectious. And there's people, like, there's these little models when someone's jogging and they're breathing and like they're spreading coronavirus all over. Or there was another one where it's like in a grocery store, if someone coughs or sneezes and it's like spread all over. And when I see that, for me, that doesn't cause panic. Like, oh my God, we need to stay inside. It's like, wow, this virus is spread really easily. It's only a matter of time. It's only inevitable that more and more and more people get this virus. And judging on the fact that the mortality rate is far lower than expected, perhaps it's time that people start going about their business and getting their lives back together. Because as I said in early March, late February, before this whole thing really popped off in the States, it was just starting to pop off in Washington. I said that at the end of the day, we need to worry more about the damage to the economy than the virus itself. And now we see that playing out. And it's not just, a small little recession or a bubble popping. In fact, this is the same continuation of the economic problems that we experienced in 2008 when there were so many bailouts that simply propped up faulty institutions that didn't deserve to continue to exist. The market should have handled that, crushed it down because it was based on false pretenses, funny money, fraudulent money. But instead, the powers that be, the Federal Reserve Bank, the Department of the Treasury, bailed those institutions out, only further in kicking the can down the road. Now we see the coronavirus, the shelter-ins have popped that bubble, have caused the financial calamity that's just been bubbling up, and there's all these little patchworks. It's like a foundation. The foundation of the house is totally busted. The house is about to tip over, and instead of just tearing the house down, letting it fall, and building up something more beautiful and sound, structurally sound in its place, people are like, the government's like sticking 2x4s on the side of it, making it appear as though it's sound. Even when Trump's like, the economy's so great, look at the stock markets, based on $24.5 trillion worth of debt, which is an absurd amount of money. This is all going to come crashing down. And we see a $2 trillion stimulus package. Now there's another $500 billion stimulus package being pushed through. But on top of that, there's been trillions and trillions of dollars that have come out the discount window of the Federal Reserve Bank. And if you understand any monetary policy or studying the Austrian School of Economics, you would know that this is how inflation happens when you inflate the money supply, devaluing the currency for everyone else. And this has been a massive transfer of wealth because that money, everybody got $1,200, and even with the Paycheck Protection Program and the SBA disaster loans, most of that money went to large firms and large corporations, and the little guy didn't even get his little piece of the action. It's all a big fraud. And you got to ask yourself why, right? I know people on the Conscious Resistance channel would appreciate this. You see Event 201 with Bill Gates. You see the Rockefeller report with the scenario lockdown. There's no question that there have been a small group of people that are hell-bent on creating more totalitarianism, creating a panopticon of a society through technology. Derek Bros wrote the Technocrat book on how to avoid the technocratic state. They are most definitely taking advantage of this opportunity and most definitely playing this opportunity up. And again, when it comes back to the media, you have a report about the antibodies testing showing that 200 to 400,000 people in LA County have the virus, a large, significant majority of which had no symptoms at all, thus making the mortality rate closer to that of the flu or just a little bit more times the flu. And instead of the headline being, the virus actually is less deadly than we originally thought, the headline is, scary. More people have the virus. The virus is spreading so fast asymptomatically. So I had to get that off my chest because it's been brewing. Another thing that really bothers me are the Karens of the world, like people I went to high school with that are like, don't talk to me again until this coronavirus thing is over with. And they're like calling the police on people that are congregating, and the police are harassing people for not wearing masks, and all these nasty people are like, I hope the protesters die and they don't deserve a ventilator. It's like, man, this is really bringing out the nastiness in people. But hopefully those of you that are watching this, you have the opportunity to be a phoenix rising from the ashes out of the destruction of the old economy, food supply system, social organization, government, out of the ashes of the old, as people continue to lose faith in these institutions, medical establishment, allopathic medicine, vaccines. As people continue to lose faith in these institutions, we, the change makers, the remnant, those people that are on the edges of society that have these fringe ideas like total freedom and decentralized peer-to-peer networks, are more resilient, more effective, more equitable even than top-down hierarchical coercive mechanisms like the state. It's our opportunity. It's our time to shine and present new ways of doing things to a world, to a public that is just like, oh my God, what the hell did we just go through? We can rush in there and say, hey, there's a better way to do things. Let me tell you all about it. Visit freedomcells.org. All right, there's a lot of comments. I'm going to try to hop on some of these comments, and then I'm going to let you go. And thank you for tuning in. Bro, how does this change the mortality rate in old people where most of the deaths are? I don't know that this changes the mortality rate for people that are already susceptible. This is not meant to downplay the threat of the virus for susceptible populations. In fact, I've mentioned that I believe a more effective policy would have been to shelter in to protect those that are susceptible to the virus. And there had been far more resources available to help those people financially in whatever way possible, medically as well. But unfortunately, governments did the opposite thing. Stephen Sweeney says, doing a lot of hustling, maybe less eager about growing your business while everyone is suffering, but good for you, bro. Huh. I sense passive aggressiveness in that comment. And if people are suffering, that is unfortunate. And I've done videos of giving tips and tools and ideas and strategies on how people can make it through this down economy, through entrepreneurship, through starting little side hustles, through whatever, Uber Eats. So there's always solutions available. And if we focus on the problem, and if we're bitter towards our friend in a passive aggressive way, that's not going to help anything. Maybe I read that wrong, but that sure seems passive aggressive to me. That's okay. Daniel Simon, not just retail food, need to open it up. Scary time for American middle class as office jobs disappear. Everything's freaking disappearing. It's a wreck. It's a calamity. It's a problem. Are you a doctor? No, I'm not a doctor, but I have a mouth and a brain and 2 eyes and 2 ears, so I can share my opinion on YouTube without being a doctor. No. Who's this? My name's John Bush. Hospitals are getting money for the deaths and a bonus for those that die on a respirator. I've read some of those reports, and that would create a financial incentive to do such a thing. The antibodies test they are using are so inaccurate that it makes these studies completely useless, and studies are being retracted. I haven't seen any of the studies that I referenced be retracted yet. I'm not an epidemiologist, but the way that they did the study seems sound to me. Perhaps you could elaborate on that. Melvis Reiser asked, do you have masks that have exhalation vents? No, these masks don't have exhalation vents. They're pretty basic, but they're multi-layered and they're super effective, and definitely more effective than cloth. And they are in stock on the website now. It doesn't work with headphones. Don't go out to the grocery store with headphones on. 98.5 that tested positive beat it. That's right. We can focus too on the people that are recovering from the virus and the people that get the virus and don't have any symptoms at all. Like for me, that's good news. That shows that the virus isn't the strongest thing out there. This sums that you believe the test or the testers or the statisticians arguably kind of like the polls and elections on roids. Well, we got to go off of something to draw some conclusions here. I mean, maybe it's all bullshit, but I'm just giving my conclusions based on what information is out there. Antibodies are resulting in 80% plus false positive rate. Show me that, and I'll report on that, but I don't think that's the case. Now it's coming. We're all immune. Already did the cranberries. 19 snow worse than the common flu. Hell, Fauci himself a few months back said it's just the flu. Oh yes, I forgot to share that. Let's see if I have this up. Okay, yeah, check this out, guys. This is the New England Journal of Medicine, and this was a couple months ago, although they released it again more recently. And it says COVID-19 navigating the uncharted. And as you see, Anthony Fauci, the head of the infectious disease unit or whatever here in the United States of America, he co-authored this report. I'm just going to read this little paragraph. On the basis of a case definition requiring a diagnosis of pneumonia, the currently reported case fatality rate is approximately 2%. In another article in the journal, report mortality of 1.4% among 1,099 patients with laboratory confirmed COVID-19. These patients had a wide spectrum of disease severity. If one assumes that the number of asymptomatic or minimally symptomatic cases is several times as high as the number of reported cases, the case fatality rate may be considerably less than 1%. This suggests that the overall clinical consequences of COVID-19 may ultimately be more akin to those of a severe seasonal influenza or pandemic influenza rather than a disease similar to SARS or MERS, which had a case fatality rate of 9 to 10% and 36% respectively. He does go on to talk about the reproduction rate, the RO. The efficiency of transmission for any respiratory virus has important implications for containment and mitigation strategies. The current study indicates an estimated basic reproduction number of 2.2, which means that on average, each infected person spreads the infection to an additional 2 persons. As the authors note, until this number falls below 1, it's likely the outbreak will continue to spread. Recent reports of high tiers of virus in the oropharynx early in the course of disease arouse concern about increased infectivity during the period of minimal symptoms. So that's the whole thing. Even though the mortality rate is low, the virus is still extremely contagious with an R number, an RO number of 2.2. That's the number that's used to measure the spread of the virus. So I'm not going to come out here and say, hoorah, we're all out of the woods, everything's totally fine. But I will come out and say that considering the mortality rate is more like the flu, which we all deal with every year. I haven't gotten the flu in a while, knock on wood. I don't think that the whole lockdown, shelter, and destroy the economy policy was worthwhile. And for those that are susceptible, the ideal public health strategy would have been to shelter those individuals in, support those individuals, help them out with food, help them out with financial support if necessary, while everyone else goes back to work so the entire economy doesn't cripple, crush, be decimated. I mean, I feel so blessed that my business is doing okay through this, but can you imagine hustling? Maybe you lost your job and you're watching this. Maybe you broke your back investing in a business, gave it your all, didn't pay yourself for years, only to see it all fade away. Like, man, there's other things to deal with here, not just health and sheltering and all sorts of stuff. All right, there's tons of comments. I want to thank everyone for tuning in and rocking out with me. This is John Bush. Again, visit bravehealthstore.com, bravehealthstore.com. If you're watching us on the Conscious Resistance, make sure you click that link down below. We have hand sanitizer. We have health supplements that will help boost your immune system. We have KN95 masks. And yeah, peace and freedom. John Bush, I'm out. Thanks for tuning in. Bye.